I want to specifically talk about our area hospitals and our area healthcare systems in central Pennsylvania and what your understanding is of where we are. The warning that you issued yesterday and then even going back to last week is dire when we talk about ICU beds and looking at our area hospitals. I had reached out to them today. They say they have plans in place to do things like doubling ICU beds or making adjustments to put patients in facilities that have the space. But when we talk about that, do you have concerns about what happens if we go through those plans and then we continue to have issues? And how much input has the Department of Health had on some of those plans when we talk about different area health systems trying to combat the challenge of running out of ICU beds?
Well, this is a very important issue. So clearly, we're in the middle of our fall resurgence. We're seeing increasing number of new cases in Pennsylvania. We're seeing increasing numbers of percent positivity in Pennsylvania, and of course that includes central Pennsylvania. And what we always have seen during the course of this pandemic is that if you look several weeks after those surges of cases, we start to see increasing rates of hospitalization, and we are already seeing that. And so we are actually seeing the most hospitalizations that we have during the course of the pandemic. So what we announced last week is just an awareness that we have been working and plan to continue to work with the hospitals and the health systems about their surge capacity, both in terms of their general beds and their intensive care unit beds. And this is what we put in place yesterday is an order which is a contingency plan that on a regional basis, if we are seeing that the hospitals are overwhelmed, then we will need to decrease elective procedures and operations 50% for 1 week as we continue to work with those facilities. So we do have great confidence in our hospitals and our health systems in central Pennsylvania and throughout the state, but we needed to have this contingency plan in place.
I did want to give them a plug, Dr. Levine, because I think you would agree that I've lived and worked in other states, and I think that we have some of the finest healthcare systems. When you talk about getting Pennsylvania out in front of this thing, out in front of this pandemic, how much has that contributed? Having a UPMC, having a Penn State Health, having Penn Medicine, how much has that helped us stay ahead where maybe other states have fallen behind?
Well, I think you're entirely correct. We have outstanding health systems and hospitals in Pennsylvania, really throughout the state. In the Philadelphia and the Southeast area, as you've mentioned, Penn State Health here in central Pennsylvania, Geisinger Health System, UPMC, Allegheny Health Network, Lehigh Valley, WellSpan. There are many outstanding health systems and hospitals that we work with on a regular basis. And we work with them primarily on a regional basis with what are called the healthcare coalitions. However, this pandemic is of an unprecedented nature, and we have to be prepared and have contingency plans in place if the health systems and the health hospitals are being overwhelmed.
Yeah, and the one thing I wanted to double back to that first question because I'm not sure we got into it that much, but one of the concerns that I got from an infectious disease expert was just that if we start to put more of our focus on COVID-19, and rightly so, then we could see complications in other areas. And I think you talked about electives. I mean, that could be one area where maybe people aren't seeing the level of care that they're used to. Do you have concerns in other areas, whether that be, treatment for folks with a heart condition or, treatment for folks with cancer, those types of things? I mean, how do we ensure that those level of services that aren't maybe critical right now, but could be an issue, a couple weeks, months down the road if care gets pushed off? How do we make sure that those are still in place and that people can still get that care?
Well, that's a critically important point. We have many people who have many other health conditions that need urgent care. And so we need to work with the hospitals and the health systems to prioritize that care if they're being challenged with the number of COVID-19 patients. So if someone does have a heart attack, that they get the care they need. Other types of procedures or admissions might then need to be postponed if they're not as urgent. And so that type of prioritization happens all the time. And it's just going to become more acute, however, as we see more and more admissions due to COVID-19.
I want to ask you too, specifically about rural hospitals. I was looking at Mifflin County today specifically. Their incident rate is through the roof, and you and I have talked about that, but they have 0 ICU beds available right now. How concerned are you about rural areas, especially rural central Pennsylvania, where maybe they don't have the hospitals and healthcare networks like we do, specifically in and around the Harrisburg area?
Mm-hmm. Well, rural hospitals have been challenged in Pennsylvania and throughout the country anyway, in terms of staying afloat. And we have actually a extremely innovative rural health initiative and hospital initiative that we have been working on throughout the Wolf administration. But you're right, rural hospitals are smaller and have necessarily less capabilities sometimes, and have less ability to deal with these surges, which is why we work on a regional basis. And that's what I emphasized last week, is that the hospitals and the health systems have to collaborate together, so that if one hospital it doesn't have ICU capacity, is that if they have someone in the emergency department, that person can be then transferred to a hospital that does have ICU capacity. So they're going to need to cooperate and collaborate together, and we will be there right with them.
And you and I focused a lot on ICU beds, I think rightly so. But one thing that I heard today from Penn Medicine LGH, Lancaster General, is that, there are concerns about staffing. When you start to get staff sick, it doesn't matter how many additions you make to take care of patients if there's no one there. How much are you getting concerned about that on a state level?
Well, we watch staffing levels very closely, and one of the metrics that we have used to trigger a decrease in elective admissions is staffing levels throughout a region. So the hospitals and the health systems need to cooperate, not only in terms of bed availability, but they need to be able to collaborate and cooperate in terms of staffing. So when we think of hospital capacity, we think of staffing, we think of beds, and then we think of things. We think of ventilators and other equipment and medication. And so those are the variables that need to be thought of as hospitals collaborate together, and we look at a regional basis about hospital capacity.
I know you have praised the National Guard. If needed, would you call on them to help our healthcare systems like you have our nursing and long-term care facilities?
I think, yes, of course, but I think that would be challenging. I mean, I think that the hospital care is quite specialized. We have some great medical personnel in the National Guard that have been really just so courageous to be so dedicated to be working in our long-term care facilities. We also have had less specifically trained National Guard that have done things like hand out trays of food and things like that. If we had to, we could deploy them to a hospital in need. But to be honest with you, right now, they're already deployed to nursing homes and other long-term care facilities.
And I do want to I want to address, so obviously the governor and your decisions aren't without criticism, already being criticized for some of the decisions that you announced on Monday. Your reaction to maybe some of the criticism and maybe some of the things that you've heard commonly, and how you've been able to address those thus far.
Sure. So, absolutely, and there's certainly room for criticism and room for discussion, and the governor and I perfectly accept that. But we feel very comfortable with our decisions. What this pandemic has certainly shown us is how interconnected we all are. And, boundaries that we usually think of, whether they're county boundaries or they're state boundaries, or things that we think divide us, such as different political parties and things like that, really, in the course of this pandemic, are not as meaningful. We are all in this together. Our actions impact other people and our community. We enjoy the blessings of tremendous freedoms in our country, but with those freedoms comes a responsibility. This is not a new concept. This has been discussed since the founding of our republic. There is a collective responsibility that we have for the common good and to help each other. And so right now, in the midst of this unprecedented global pandemic, that means wearing a mask. That means washing your hands. That means social distancing and avoiding large and now even small gatherings. And if we stand united, we will be successful in our battle against this dangerous virus.
Last question, because I know you have limited time and you're busy. Why the focus on bars and restaurants when they had a laundry list of guidance and regulation that they were already navigating through, whether that was alcohol served after 11 and not seating at the bar and then serving alcohol with food? You know, a lot of people didn't foresee maybe a gathering at bars this year because of some of that guidance. Why then the move to not serve alcohol after 5 until 8 in the morning? Can you explain that a
Well,
little bit?
this is one specific measure for bars and restaurants on Wednesday night. And it turns out that the night before Thanksgiving is a very, very big party night in bars and restaurants. And what we're concerned about is that there would be a lot of people congregating together in that indoors closed space. As more people drink alcohol, sometimes they become less inhibited. They might not wear a mask, they might not social distance or wash their hands as well. And that could lead to even more community spread. So, we know that what we're asking that evening, but as well as, for instance, on Thanksgiving and in the holidays to come, is a sacrifice. But it is a shared sacrifice that we need to make together to protect our communities from the spread of this virus.
And a lot of people see you as the face of the state mitigation efforts. I mean, have you had talks with the governor about just assisting restaurants and bars after, every time a measure is put in place like this, do you have a conversation like that? Does that come up like, we're going to do this, then, we've got to find different ways to help them? Even though, like I said, that's not necessarily your job, but I'm sure you've had the conversation.
Yes, we have collective conversations, with the governor and the governor's staff and other cabinet members about the public health measures that we're taking, but as well as the social and economic consequences. And we know that restaurant and bar owners are suffering. And the governor has been talking for months now about economic relief for those small business owners. And we hope to have collaboration with the state legislature in the future to be able to provide that economic relief.
I appreciate your honesty and your time. Happy Thanksgiving, Dr. Levine. Best to you and yours.
You too. Thank you so much.
Thank you for your time. Appreciate it.
Bye now.
Take care.